Bonjour à tous, bienvenue.
Good day, everyone.
Conference for a coronavirus update is in the Sir John A. Macdonald building in Ottawa on Friday, February 11th. I'm Greg Quinn with Market News International. With us today are Jean-Yves Duclos, Minister of Health, Dominique Leblanc, Minister of Intergovernmental Affairs, Infrastructure and Communities, and Dr. Theresa Tam, Chief Public Health Officer. Alors, avec nous aujourd'hui, Jean-Yves Duclos.
Today we have Jean-Yves Duclos, Minister of Health, Dominique Leblanc, Minister of Intergovernmental Affairs, Infrastructure and Communities, Dr. Theresa Tam, Chief Medical Officer.
We have reporters in the room, and I will take a batch of questions from them first. We also have some people on Zoom, so let's remind everyone to minimize outside noise if you're online. And please identify yourself and your media outlet when asking a question and a follow-up. Dans une question, une supplémentaire. Let's begin with some opening statements and then questions, please. Ministers, à vous la parole.
The floor is yours, Ministers.
Very much. Bonjour tout le monde.
Hello, everyone.
And good afternoon from Moncton, New Brunswick. As was just indicated, I'm joined today by the Chief Public Health Officer of Canada, Dr. Theresa Tam, and my colleague, the Minister of Health, Jean-Yves Duclos. Alors, sans plus tarder,
Without further ado, I know that Jean-Yves has some opening remarks to make, as well as Dr. Tam.
begin by starting with the Health Minister, Jean-Yves Duclos. Over to you.
Oui, bonjour tout
Yes,
le monde. Merci Dominique, merci.
thank you, Dominic. Thank you, Minister Leblanc. Thank you, Dr. Tam, for being with us today for an update on the COVID-19 situation.
Prime Minister Leblanc, Dr. Tam, to provide an update on the COVID-19 situation in Canada. J'aimerais tout d'abord revenir sur certains
I'd like to begin with discussing events that have been in current affairs this week. A couple of days ago, my colleague Joël Lightbourne made a public statement. First, I should say that I have a lot of affection and feel that I am a good friend of Joël's. We have discussions regularly on numerous issues, including the management of the pandemic, and I've always appreciated the time and quality of those exchanges. In democracy, it is healthy that everyone should be able to express their opinions freely. Debate and discussion needs to be encouraged. We know that everyone wants to see this pandemic over and done with. We all can't wait for that to occur. Just like Joël, in Quebec City, in my riding, and in Ottawa, I hear that loud and clear. We know that to get through this, we need to continue to work together in a caring way and showing respect. We need to show a common front to fight this virus. This is true of vaccination and of all of the public health measures that are still in place. For the past 2 years, the government has taken action to combat COVID-19, and it's been focused on science and also caution. Science evolves constantly, and just like at the beginning of this pandemic, we are continuing to base our decisions and our actions on science and data. The current health measures are temporary. Some will be with us for a long time. Others will be lifted as soon as the epidemiological situation, science and prudence permits. It's crucial to bear in mind that these measures, whatever they be, are to limit the harm done by the virus. All of these measures are constantly reassessed, and we are going to continue to tweak them based on science, data, and the evolution of epidemiology. The worst is behind us, and the government is adjusting measures actively at our borders, and in short order, we should be able to announce changes to border measures next week, with, of course, the support and collaboration of the public health team led by Dr. Tam. We'd all like to know with certainty what the next weeks and months have in store for us, but after 2 years of the pandemic, we know full well that this virus is still got surprises in store for us. We know that it's not a question of whether there will be future waves or other variants, but when. Over the past couple of days, on a number of occasions, we've heard the utterance, "We can't wait to just live with the virus." We all agree that it will come time to live with the virus. But concretely, what does that mean exactly, to live with the virus? Let me try and respond to that question. And I don't want to come across as a teacher, even though I was a professor at Laval University. Living with the virus means first and foremost that Canadians shouldn't be dying in such great numbers. Second, living with the virus means that the virus and our healthcare system may be able to coexist without the healthcare system being paralysed, without patients who have cancer being told that their surgeries are being delayed because our hospitals and our healthcare professionals are overloaded with COVID cases. Third, living with the virus means that collectively and individually we need to optimise the tools at our disposal, in our toolbox, to combat transmission and spread and limit the severity of infections. Fourth, living with the virus also means that we cannot be dishonest. We need to be clear-thinking, clear-minded, and acknowledge that it is not only possible, but likely that the months may have bad surprises in store for us, the months ahead. Fifth, living with the virus means that we cannot expect to live without the virus. Sixth, living with the virus means also that we are not impotent in front of before this virus. I repeat, we are not impotent in the face of this virus. We have a number of tools to ensure that this virus is not as severe and that it doesn't disrupt our personal and professional lives too much. And our professional opinion remains that vaccination is the top priority and the best way to protect Canadians. Even though vaccines are imperfect, science is unequivocal on the matter. Vaccinations reduce the spread and prevent severe cases of infection. If we are able to prevent severe cases, our hospitals and our healthcare professionals will no longer be overwhelmed. If our hospitals and healthcare professionals are no longer overwhelmed, then the healthcare measures don't need to be as strict. That much is obvious. But it's important to remind Canadians that collectively and individually, it's within our power to change things. Living with COVID-19 means that we wield this power to minimise the impact on our daily, everyday lives. Now, finally, given that the worst of Omicron is behind us, living with the virus also means that we can't simply rest on our laurels and wait for the next variant or the next wave before strengthening our vaccine rollout. We need to administer more booster doses, more doses to children, so that the next variant, the next wave, will not be as resilient or dangerous. 50% of eligible Canadians have gotten their booster dose. 55% of Canadians, children, have received their first dose. This is good, but we need to continue in this direction. Now I'll repeat what I said in English.
I would like to address some of the events that have marked the news this week. A few days ago, my colleague Joël Lightbound held a press conference in this very room. I have a considerable level of affection and esteem for my dear friend Joël. We regularly discuss many issues, including the management of the pandemic, and I have always valued and appreciated his input. In a democracy, it's a healthy habit for everyone to be able to express his or her opinions. Debate and discussion should always be encouraged. We all know people who are eager to be done with the pandemic. And to be honest, we're all eager to be done with it. Like Joël, I hear it at home, in Quebec City, and here, certainly, in Ottawa. We also know that in order to get out of this phase of COVID, we must continue to work together in a spirit of benevolence by joining our forces against the virus. This is true for vaccination. It's also true for adherence to all the public health measures that may still be in place. For 2 years now, our government's actions in the fight against COVID-19 have been based on science and prudence. As we all know, science is continuously evolving, and as we have done since the beginning of the pandemic, we will continue to base our decisions on the best available scientific information and on prudence. Now, let's be clear. The public health restrictions currently in place by provinces and territories in particular were always meant to be temporary. Some of these restrictions will be with us for a long time. Others will be lifted as soon as the epidemiological situation, science, and prudence allow it. That said, it's important to keep in mind that these measures are intended to limit the harm caused by the virus. All measures are subject to constant reevaluation, and we will continue to adjust them according to science and prudence and the evolution of the epidemiological situation. With the worst of Omicron now behind us, our government is actively reviewing the measures in place at our borders, and we should be able to communicate changes on this next week with the support and the advice of the team of Dr. Tam. We would all like to know for sure what the next few weeks and months have in store for us, but after 2 years of this pandemic, we know that this virus will always find a way to surprise us. We know that the question is not whether there will be other waves or variants, but rather when. Over the last few days, we have all heard the phrase, "We have to live with the virus." We all agree that we have to learn to live with the virus, but concretely, what does it mean to live with the virus? Now, let me humbly suggest a couple of answers to that question, using perhaps a more professorial tone in line with my earlier career in 2015 as a professor of economics at Université Laval. Firstly, I would say that living with the virus means that people have to stop dying because of it in such large numbers. Secondly, living with the virus means that the virus in our healthcare system must be able to coexist without the latter being paralyzed. Without cancer patients being told that their surgeries will have to wait because our hospitals and our healthcare workers are overwhelmed by COVID-19. Thirdly, living with the virus means that we must individually and collectively optimize the entire use of our tools in our toolbox at our disposal to limit transmission and the severity of infections. Fourthly, living with the virus also means that we must be honest with each other and recognize that it's not only possible, but very likely that the coming months will hold other unpleasant surprises. Fifthly, living with the virus means that we must remember that we are not powerless in that situation. We have power. We can help ourselves, and we must keep helping each other. We have the power to make it so that the public health restrictions imposed by provinces and territories are less severe and disrupt our social life and our economy as little as possible. Our main tool for that remains, still and always, vaccination. Even if we know that vaccination is imperfect, the science is unequivocal. Vaccination does reduce transmission and does prevent severe complications. If we can prevent severe complications, our hospitals and healthcare workers will not be overwhelmed. If our hospitals and healthcare workers are not overwhelmed, then, in turn, public health restrictions will be less severe. It's obvious, but it's important to remember we have individually and collectively the power to change things. Living with COVID means that we must exercise this power. That's the only way to reduce the impact of the virus on our lives. Finally, now that the worst of Omicron is behind us, living with the virus means that we should not wait for the next variant or the next wave to enhance our vaccination campaigns. We must continue to administer booster doses, pediatric doses, as many as possible, including first, second, and third doses, so that when the next wave or the next variant does come, we are better prepared and more resilient. 50% of all eligible Canadians have received a booster dose. 55% of all children aged 5 to 11 have received a first dose. That's good. We must continue. Together, we can do this. And I'll now turn to Dr. Tam.
Bonjour à toutes et à tous.
Yes, good day, folks. Good day, Canadians. Indicators of COVID-19 disease spread, including last lab test positivity, RT, or effective reproduction number, wastewater surveillance trends, and daily reported cases all indicate that Canada is past the peak of the Omicron wave. Although the latest national 7-day average remains above 11,000 new cases reported daily, weekly declines were reported by all jurisdictions across Canada.
Severe illness trends remain high or are still increasing in some areas of the country. However, we are starting to see hopeful signs, with weekly reductions reported in most jurisdictions. Compared to last week's update, there are now an average of 1,400 fewer people with COVID-19 being treated in hospitals each day. However, that is still a 7-day average of over 8,700 each day, including over 1,000 in intensive care, and 130 deaths were reported daily. As we continue to take measures to mitigate the ongoing impact of COVID-19 on the health system, health authorities across Canada are looking ahead to longer-term sustainable management of the SARS-CoV-2 virus. This includes transition plans for the immediate future as epidemiologic indicators of COVID-19 disease activity continue to improve. This will allow jurisdictions to begin to ease restrictions. It also includes planning for the months ahead and beyond, when we can expect the virus to still be with us, including emergence of new variants with uncertain transmission and severity characteristics. However, what will not change is the advantage to be gained by maintaining a state of readiness. This includes monitoring to detect signals of concern that can enable early and appropriate public health response at the population level. At the same time, providing guidance and tools to support risk-based decision-making can continue to empower individuals, families, and communities to reduce their risk through personal protective practices. À plus long terme, nous pouvons.
Moving into the long term, we can rely on the strong foundation of protection gained through science-based development and application of a range of interventions. These tools, including testing, public health measures, vaccines, clinical management and treatments, have worked to substantially minimize the overall impact and severity of the COVID-19 pandemic to date. And though resurgence is still possible, especially as public health measures ease, increasing availability and rapid application of these tools can help to lessen the impact on hospitals. Moreover, they can help protect our most vulnerable populations and minimize the need for broad restrictive measures going forward.
While this has been a long and difficult journey, there's a lot to be grateful for. Reminding ourselves of how we've kept working together across the country, learned to protect ourselves and each other in the face of uncertainty, and then adapting to changing circumstances is a testament to our resilience. More importantly, it is a perspective we need to feel assured that with continued innovation and creativity, we can successfully adapt and overcome the challenges ahead. Pour le moment, au cours de cette période de transition,
for now, during this transition phase, it is particularly important to relieve the pressure on our hospitals by closing vaccine coverage gaps and maintaining core personal protective practices.
Plus précisément,
In particular, millions of eligible Canadians could reduce their risk of ending up in hospital with severe COVID-19 disease by getting up to date with vaccination.
doses of COVID-19 vaccines offer reasonably good protection against severe disease. And receiving an mRNA booster dose when eligible offers superior protection, keeping more people out of hospital and preventing more deaths. Cependant, comme
However, as no vaccine is 100% effective and immunity may decrease over time, maintaining personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces, continue to be important risk reduction measures now and going forward. For the ongoing efforts of countless Canadians, thank you, thank you.
Thank you, everyone. Looks like time for questions. As discussed, we will start in the room. I'd like to start with Kevin Gallagher, CTV, please.
Good morning. My first question is for Health Minister Jean Duclos, and also Dr. Theresa Tam can follow up as well. Given this reevaluation, it seems that's happening ongoing, as you say, for public health measures, and we'll lump in their mandates. I'd like to ask, what data or studies contributed to imposing specifically vaccine mandates? In terms of, was there any data that showed that this would be the best way to increase uptake of vaccinations, especially when we're talking about people who are vaccine hesitant or anti-vax? Obviously, I don't need to remark about why I'm asking this question. Ottawa has been occupied by what the mayors call the siege, by people who have strict and staunch views against vaccination and feel that their rights have been violated in some way by mandates. I'm not here to necessarily debate whether the government can put mandates in or not, but I'd like to know if there was any data or studies that backed up the decision to impose them as a way to encourage people to get vaccinated, and if there's any evidence to show that that measure would be useful for people who are already vaccine hesitant or staunchly anti-vax.
Well, thank you for the question. I'll start by saying that vaccination is not punishment. Vaccination is protection. In fact, it's a protection that science gave us about a year ago. We had hoped about 2 years ago that we would eventually be able to have vaccination as protection. That came enormously faster than scientists at that time, about 2 years ago, thought it would come. And since about a year now, we have had the gift and the fortune of being able to vaccinate Canadians across the country. So it's not punishment, it's protection for the person. When I have been vaccinated, I receive my booster dose. When I do that, it's because I want to protect myself. But I also do that because I want to protect my family, my parents when I go and visit them, my friends when I meet them. And when I see my children be vaccinated, I'm glad for them. I'm also glad for their friends that they will be able to be engaged with. So it's not punishment, it's protection. The second thing is about the protection of vaccination. Dr. Tam might want to summarize the current knowledge around virology and immunization. But we know, as she summarized earlier, that although it's not perfect, it's working. But it's working even more with booster doses. And that's the key message, I think, that Canadians would like to hear again today, is that a booster dose is needed, is useful, is important for all eligible Canadians. And the third thing is that vaccination mandates work. 99% of public servants have done the right thing. They have been vaccinated. Some estimates both within Canada and outside Canada suggest that a large number of Canadians were perhaps better able to understand the value of being protected and to be able to lead a more normal life through vaccination. There are some estimates that it could be up to 3 million Canadians that over the last 6 months, because of mandates and at the federal and provincial levels, now chose to be vaccinated, perhaps quicker and perhaps in large numbers. Let's imagine what the situation with Omicron would now be if we had 3 or up to 3 million Canadians not vaccinated with the current situation. And finally, and I'll turn to Dr. Tam in a second, the reason for which, an important reason for which we are moving away from the peak of Omicron is that large number of Canadians, not large enough still, about 50%, have received a booster dose over the last few weeks. That gave them extra superior protection against Omicron. And in addition to that, now people have been making the right choice. Now they obviously understood that public health measures were there to protect them. We followed them in large numbers, and that's therefore one more reason for which we do have this ability, in addition obviously to the natural immunity that has been created through the large incidence and infections of COVID-19. Some estimates in Quebec and Ontario suggested it could be up to about 20 to 25% of Canadians that have been infected since the start of Omicron in December. So these are large numbers of people either naturally immunized or because of vaccination. And I know I'm speaking a bit too much, perhaps, but I should turn immediately then to Dr. Tam.
Thank you. I won't add too much on the vaccine mandates, but there's now obvious evidence that they work. And I think in the Canadian context, you can look at it for individual jurisdictions, but immediately after an announcement of vaccine mandates, and then the actual operationalization of them, there was an uptake. We saw a plateau in the uptake of vaccines after a really tremendous effort by Canadians. And then after the introduction of vaccine mandates by the various provinces and territories and jurisdictions, we did see an uptick, and that can be different between jurisdictions, but there definitely is one. And there's increasing international literature showing that mandates work. But it's not the only tool, and it never has been. For us in public health, building vaccine confidence and trust is the primary tool. Providing the general public with robust information and trusted messages is really key. Providing access to vaccines is really key because many populations had difficulties accessing the vaccines, maybe because they work different hours. So getting access was very important. Reducing inequities, helping debunk misinformation is extremely important. And I think vaccine mandates may particularly nudge those who are in the middle trying to figure out whether they'll get it or not, has prompted them to actually get vaccinated. But there was certainly a huge number of Canadians who were very much supportive of the evidence-based measures, such as vaccination being a really incredible tool.
I'll just follow up. My question wasn't really about whether I have listened to many of these press conferences and have listened to the data about how vaccines are effective. I understand your point about how mandates have increased the vaccination rate in some cases. My question was quite specific about, and maybe I'll just frame it in another way here. What's the plan to reach out to people who are so opposed to vaccination, perhaps basing their information on misinformation, as Dr. Tam just pointed out, that they would be willing to, pretty much put their lives on hold to paralyze the nation's capital? What is the best method to reach out to some people who seemingly don't trust the opinions of Dr. Tam, don't trust your opinion, Health Minister, and have lost faith, frankly, in my reporting and other of my colleagues in the mainstream so-called media, right? So what is moving forward, should there be a different approach or tactic for reaching out to people who are staunchly anti-vax and very much opposed to mandates or vaccinations in general?
Well, this is a great question. I would separate the answers in two parts. First, benevolence, and second, trust. I think we want to speak benevolently about vaccination. It's again there to protect people. It's not there to punish people. And in speaking about that, the benevolent value of vaccination, the good, because benevolent means you want good. I suppose it's from Latin. So you want good for others, and I think it's a language that not only unites people, but as you said, brings people forward. Now, on trust, I agree. There is a lot of disinformation around all sorts of things, including around the benefits of vaccination. But I'll turn to Dr. Tam quickly, because PHAC has, obviously, in collaboration with many partners, many of them at the provincial and territorial levels. PHAC did succeed in providing both the benefit, the value, the benevolence of vaccination, and also decreasing the disinformation to which you alluded. Dr. Tam, would you like to give a few examples of how PHAC does that?
Yes, I think recognizing that not everyone listens necessarily to government sources, or indeed some other really incredible expert panels, such as National Advisory Committee on Immunization, we funded a whole range of projects that enable other leaders in the community, elders, religious leaders, are supported in the way that they can further support their own communities, Black Canadians, and other communities who, quite frankly, had lots of reasons to be distrustful of government and authorities. They've been brought along to get vaccinated because of the trusted voices in their own communities. And that has got us to this far as Canada having one of the best vaccination rates in the world. But there will always be a small percentage of people who will not essentially take up the vaccine, no matter what we do. And that has been observed in a multitude of vaccination campaigns. And that is probably to be expected, that some people will not change their minds. But because so many people, the vast majority of people having been vaccinated, we are able to move forwards in our transition to be able to manage this virus and COVID-19 in a more adaptable and sustainable way.
Before we turn to the next question, I just should insert one thing. I'm aware that I believe Mr. Duclos may have to leave in about 15 minutes, and we have other questions in the room, but we have some Francophone reporters on the line. I have an obligation to take the questions in the room first, but if we show a little more vitesse, we might be able to get all questions in both languages. And before you go, thank you. David Aiken, Global, thank you.
David Aiken, Global, and I'm going to stick to English. My other official language is not so good, I'm afraid. Question first for Dr. Tam, and then I'd like to hear Minister Duclos. Through this pandemic, when we've instituted border measures, it's been very clear that one of the goals of any border measure was to reduce or prevent transmission. So, Dr. Tam, to the extent we're testing and tracing, can you tell us and set the stage, what data do we have that any new transmission in Canada is a result of travel? If I could get you to speak to that, and then if you could follow up, Minister, to say, as you consider lifting border measures or changing them next week, are you still worried about transmission from travelers? Just transmission right now at this point. Dr.
Yes, so one of the objectives, particularly when new variants emerge, is to reduce importation risks, which could then lead to transmission. So we do know that the positivity rate, as one might expect, with Omicron surge, for example, has led to a very high positivity rate in travelers that we could detect as they come across the border because of the post-arrival testing. They surged to very high levels at the end of December, beginning of January, and then just beginning to come down. But the positivity rates, I'm sure the minister will speak to that, was actually extremely high. And each one of these individuals can potentially transmit to others, not because they're they want to, but because this virus is so difficult to manage and can transmit even before someone has symptoms. So by providing testing, but also the quarantine and isolation measures, that's are there to try and reduce that. But we know that that's not a perfect system. And because of the nature of Omicron and how infectious it is, it's very difficult to prevent every case of importation and their onward transmission. Provinces have demonstrated how the initial introduction have spread, of course, first to household members, but then even unbeknownst to them, they've gone to school or work and have transmitted thereafter. But we do have to adapt our border stance because we know it's pretty impossible to reduce every single case of importation. It's already in Canada and it's transmitted widely throughout our communities. But we do still have to look out for other variants and new variants and try and detect them as early as possible and reduce their potential impact, at least to slow them down so that we can understand them better.
Yes, thank you. I may add briefly that we've all learned that the virus spreads through contacts. No, the reason for which the virus moves is that people are in contact with each other, and traveling is obviously one way through which we may be in contact with others. So the objective is to protect people against the risk of being in contact with other infected people. Dr. Tam mentioned those statistics that you can find on the web. The PHAC website is accessible. If you look at the most recent statistics, you'll see that the positivity rates of travelers entering into Canada in January ranges between 6 and 9%, despite having those travelers showing a negative pre-departure test. So 6 to 9% positivity rates among travelers entering into Canada. And that's why, as we think thoughtfully, but obviously clearly with the assistance of public health, about the multiple layers of measures that we want to have to protect people both across the borders and in other ways as well, on trains in Canada, the public service, as I mentioned. So as we thought, I would think carefully about those multiple layers. The overall objective will always be to protect the safety and the health of people, and we look forward to further guidance on that.
Thank you. And then just to follow up, Minister Duclos, border measures are often implemented sometimes with our international partners, sometimes not. We've coordinated with the Americans, sometimes not. Can you speak to, are we being held up by, because we need to negotiate with the Americans, say, on cross-border traffic that way? Are we going to act unilaterally? Can you give us a sense of discussions you may have had or the government may have had with international partners on changing border rules?
Well, two objectives here, and that's a great question. The first one is obviously to serve Canadians and to protect their health and safety based on the local epidemiological situation in Canada and the national advice on from experts. The second objective is obviously to be as much aligned as possible with other partners, but we can never be totally aligned because, as we all know, the situation changes. It comes in waves at different times across different places. So these two objectives reinforce each other. Always A, protect the safety and health of Canadians, and B, do this to the best extent possible with international partners.
Press. This is for the ministers. Perhaps Minister Duclos, you're in the room, but perhaps Minister LeBlanc. How will the new Ontario State of Emergency powers help clear the Ambassador Bridge and end the protest in Ottawa? And why did it take 2 weeks to see that? What have you been doing in the meantime to get to this point?
Well, I'll turn immediately to Minister LeBlanc. I don't know if Dominic is a doctor, but he's certainly a minister. And Dominic has been extremely engaged with many, and he will indicate in a moment, and will have something to say, I'm sure.
So, merci. Thank you, Jean-Yves. We have been working in a collaborative way with the Government of Ontario, with Premier Ford and his ministers, obviously since the beginning of the occupation in Ottawa. The Prime Minister spoke with Premier Ford I believe, on Wednesday evening. I spoke with the Premier late last evening, on Thursday evening. He was still at his office working on the details of these emergency measures that he announced this morning. We think that's a very, very positive step from the government of Ontario. We think that that will help remove the illegal blockades at border crossings that have threatened not only the Canadian economy, but thousands of jobs that depend on that very active cross-border trade. And obviously, we remain very concerned and very engaged on the unacceptable and illegal occupation in the city of Ottawa. I was in Ottawa all this week, and I can understand the frustration of the people who live and work in the city of Ottawa. We think that the measures that the Ontario government announced, particularly economic measures, punitive economic measures for people who use trucks in a way that is illegal and disruptive to public safety and to the economy of the country. We think that this is a very, very important and welcome step that the government of Ontario took today. And my discussion with Premier Ford is how we can continue to work with them and support them and their law enforcement authorities in any way possible, because these blockades need to be removed and need to end. And obviously, the occupation in the city of Ottawa is in the same category.
Specifically, does this new power give law enforcement to end these blockades, especially given, I mean, there were calls from the United States government for Canada to do something with the Ambassador Bridge. Isn't that just a little bit embarrassing? What are they specifically are they going to do? Why is it, and why did it take so long?
Well, I think obviously the Prime Minister, his officials, the National Security and Intelligence Advisor to the Prime Minister have been in touch with their counterparts in the United States government. There have been obviously conversations with the governor of Michigan as well. So we have been very engaged with our American partners because we share their very real frustration with these illegal and unacceptable blockades. Because somebody doesn't agree with a particular public health measure doesn't entitle them to damage hundreds of millions of dollars of cross-border trade or create enormous disruption and abuse on the streets of the nation's capital. That is not the way to have a thoughtful discussion about evolving public health measures. So we certainly share the frustration that Premier Ford expressed this morning. This has been an ongoing collaborative effort with the government of Ontario and other provincial governments since the moment these illegal activities began. So what you're seeing now, from our perspective, is a very important series of additional steps that the government of Ontario is putting into place. And as the Prime Minister has said in numerous conversations with provincial counterparts, and my federal cabinet colleagues have been obviously in touch with their provincial counterparts, not just in Ontario, but across the country. The government of Canada will be ready to do whatever we can to support local and provincial law enforcement authorities to make sure that these illegal activities come to a conclusion quickly.
Hi, Dylan Robertson of the Winnipeg Free Press. Question for Minister Duclos. I wanted to ask about the take-home PCR testing program at the border. We've interviewed rural Manitobans who have had couriers and taxi cabs drive as long as 10 hours to go pick up a single sample. This is likely costing upwards of $1,000 each time. Your department seems to have no issue with this. Is this a prudent use of taxpayer funds?
Thank you for the question. I'll limit my answer to two things here. We have obviously a big country. Our people live in very different places and sometimes quite far away from urban centers. But everyone has a right to receive the same quality of services. It's the foundation of all the broad healthcare agenda. The second thing is that given that, our suppliers, PHAC suppliers, have been told that they need to do what is needed to do to provide everyone with the the level of service that they need and deserve. And that's for them to decide on the way in which that has to be done.
Thank you, Minister. And Minister LeBlanc, the Manitoba government says that your government's tone is making things worse and inflaming things. They argue that the convoy that's blocking Manitoba's main crossing with North Dakota wouldn't be so dramatic if you had a more measured tone. Do you accept that you're making this problem worse for the provinces?
I think as my colleague Jean-Yves Duclos made clear, the decisions that we make and the measures that we have taken from the beginning of the pandemic have been guided by the best medical and scientific advice that we have available as a government and with international partners. Dr. Tam obviously speaks with her counterparts in other jurisdictions across the country, but around the world as well. So that has to be the basis for governmental decisions. If a bunch of people are unhappy or disagree with the science or decide that they're not going to follow the best public health advice that they can be given and decide to undertake an illegal blockade of a border crossing like in Emerson, Manitoba, or occupy the downtown core of Ottawa, that doesn't actually constitute medical advice or a clinical trial. It is a disruptive, illegal practice that harms thousands and thousands of Canadians who want to do the right thing, want to manage the risks of COVID, but want to be able to go to work safely, want to be able to operate small businesses. So the tone is also commensurate with the frustration that businesses feel, that residents feel, by these continued illegal blockades. So our measures will always be based on the best public policy, scientific and medical advice that we can receive. As Jean-Yves Duclos and Dr. Tam said, they will evolve over time, as was always understood, based on that advice. But the Government of Canada's job is to work with provincial and local law enforcement partners and provincial governments, as we have been doing, obviously, extremely actively, to bring these illegal blockades to a conclusion as quickly as possible.
Okay, I would like to turn to one questions on the phone en français. Julien Lapointe, Radio-Canada.
Julien Lapointe, Radio-Canada. Yes, thank you for responding to my question. Here's what I'd like to know. On what factors, figures, data are you basing your decisions to lift restrictions at the border? What indicates to you today, for example, that we are not ready to lift all those restrictions on travellers, that we may be ready sooner rather than later? Response. Well, I'll give you a quick answer, and perhaps Dr. Tan can add on to that answer if she sees fit. First, in Canada, we are still in the midst of an Omicron crisis. There are over 8,000 Canadians that are hospitalised, which is considerably higher than the average hospitalisation rates over the past 23 months in Quebec and elsewhere. So we're not out of the woods. Even though we're doing better in terms of Omicron, we're not doing well, especially across all regions of Canada. Secondly, outside Canada, in some locations, the situation is getting worse. So it's, as we always do, we will base our decision-making on science and prudence. Science, of course, evolves, and prudence, well, our key objective is to always protect health and safety of Canadians. Finally, we are lucky in Canada to have several layers of border protection which have worked very effectively for the past 23 months. Given that we have several layers of protection, we can play off them in terms of the evolving epidemiological situation in Canada domestically and also abroad, always with the view to protecting the health and safety of Canadians. Dr. Tan, perhaps you'd like to add to that.
Oui, je suis d'accord.
Yes, I agree with Minister Duclos. we're talking about a combination of indicators here. The epidemiological situation, of course, and especially the hospitalization rates. Is the healthcare system equipped to maintain services and to serve Canadians? Now, we do currently enjoy a high vaccine coverage across Canada, especially given that most Canadians have had 2 doses. There's also been increased immunity among Canadians, primarily due to vaccination, but also previous infections. Omicron infected many Canadians. Consequently, the herd immunity in the Canadian population is a tad higher than it was previously. Furthermore, as the Minister indicated, it's the epidemiological current state of affairs worldwide as things stand. However, the Omicron wave is slowly petering out. In a number of countries, however, Omicron has just started to infect local populations. In other countries, the wave is coming to an end.
D'accord. Et question pour le ministre.
Follow-up question, Minister Duclos. Your friend, Joel Lightbound, and also the Conservatives are calling for a timetable for the lifting of restrictions so that Canadians know in what direction they're heading. Are you in agreement that we need such a timetable, and are other provinces going to do so and territories in collaboration with you? Response. Well, I'd like to start by saying that there's great news in terms of vaccination. For example, today, there are about 10,000 Canadians over the age of 12 who will be receiving their first dose. There are 6,000 children today who will be receiving their first dose of the vaccine. There are about 150,000 Canadians today alone that were receiving their booster doses. So we are moving forward in our vaccination rollout, and as Dr. Tam indicated, this further reinforces our protection against the virus, especially vis-a-vis how things were back in December. Now, as far as COVID-19 restrictions are concerned, the Conservatives are calling on the government to set out a timetable, i.e. that at a certain date there will be no more COVID-19. No government, no minister can tell Canadians when the virus will be over and done with. So here's what we're going to continue to do. We are going to tweak our plan, the plan that has been in place for 23 months, with a view to protecting Canadians in a responsible way, in a science-based way, and by using the expertise and skills of our healthcare professionals. COVID has a lot of surprises in store for us, and unfortunately there may be more surprises in the months and weeks to come.
Yeah, we do have 3 other questioners, including Stéphane Blais avec Presse Canadienne. Est-ce que c'est possible?
Is it possible to have another question? Is it possible to field another question? Yes, Mr. Blais, please go ahead.
Vous m'entendez?
You can hear me, I trust? Yes, we can. Good. Do you have any data about the transmission of the virus from cross-border truckers? And is the vaccination mandate for truckers so important when it comes to protecting Canadians? What about from a social peace standpoint? Response. Thank you for the question. Once again, vaccination isn't a punishment. It's a form of protection. When one chooses to get vaccinated, and I know this, that everyone in this room, for example, has chosen to get vaccinated. Anyone I talk to has done so to protect those folks with whom they're in contact. It might be loved ones, it might be family members, it might be work colleagues, acquaintances, and that is why vaccination is a way of protecting not only yourself, but those around you. It's a benevolent measure. It's a choice to be benevolent and caring. It applies to all those who cross the border as well. And we're doing this in a symmetrical way with the United States. That said, we always are in constantly reassessing the situation. But for the time being, the rule remains the same. If we want to limit restrictions, the closure of schools, the closure of businesses, if we want to avoid seeing these kinds of problems with cinemas and theatres that are closing. Thankfully, most of them are reopening across most areas of Canada. But if we want to minimise lockdowns, vaccines remain our best bet.
Mais avez-vous des données?
But do you have any data on the spread of the virus by these cross-border truckers? Dr. Tam, I'll hand the mic to you. But what I can say first is that when people cross the border, of course, there's more frequent, increased contact. That's what public health is telling us. And intuitively, we also know this to be true. What we are also hearing from the transportation sector is that the lion's share of businesses and representatives of these businesses and workers are in favour of a vaccine mandate because not only does it protect their workers, it protects their businesses, their companies and supply chains. What we've seen over the last couple of days and weeks are reports from industry stakeholders that are telling us the problem isn't vaccination, the problem is absenteeism as a result of illnesses. The fact of the matter is that a lot of truckers over the past weeks and days have been absent because they fell ill, and that's due to contact with other colleagues, with mechanics, with shippers, and of course, increased contact means greater spread of the virus. This makes the supply chain more fragile, businesses more fragile, and of course, it undermines the health of our truckers, who we rely on just so much for our economic recovery.
All right, I'm sorry, go ahead.
We come,
Well, yes, there are a lot of essential workers that have been infected with Omicron over the last week alone. So truckers are no different to everyone else. We're talking about the same population here. We don't have a breakdown of the figures based on occupation. That's not one of the indicators in our databases. It's the provinces in the provinces and territories where there is monitoring of infections and cases by local jurisdictions. So I don't have those figures at hand, unfortunately.
I'm told Mr. Duclos may have to leave. I'd just like to stress that we have questions from Globe and Mail and CBC left here on the line. It would be great if the others have time to take them.
I can.
Okay.
I'm happy to stay for about another 5 minutes.
Okay.
I was told it was over at 12:30, but I can stay for 5 more minutes.
Okay, we will. I'll try one more. We'll see how fast we can squeeze. Thank you. I appreciate it. Let's try. Oh, I'm sorry. We may have one. David Thurton, CBC. Go ahead, please.
Hi. Dr. Tam, what is our new vaccination goal now that there are boosters? Is there a new specific goal that we're trying to hit here?
as many people as possible is the goal. And I've said it even for 2 doses, is shoot for the stars. There's no specific levels, but you want it to be really high, particularly for the high-risk groups. I actually think that for the older age groups, which are some of our highest risks, the booster rates are pretty good. But there are still some seniors, particularly those over the age of 60, who still haven't got their booster dose. It's really important that they do, because the booster actually really increase your protection against severe outcomes. It can actually also reduce your risk of getting infected for a period of time as well, which can be important during an actual wave. But the durability and the quality of the immune response against severe outcomes is augmented for sure by the booster dose. For the younger population, there is a gap at the moment. And again, whether it's for the personal protection or for making sure that we have a healthcare system that's sustainable for all illnesses. It's a great idea for everybody to get their boosters when they're eligible.
So does that mean that our goal is, 100% vaccination? And if that's the case, that would be the ceiling. But what's the floor of that goal? What's the minimum you think we're trying to achieve here?
Our goal overall in Canada's pandemic response is to reduce severe outcomes, morbidity, mortality, and while balancing that against societal disruption and business continuity, and everything can be maintained better if people were vaccinated. So I can't really answer your question because it's really as high as possible for a while. I mean, our goals and our science evolved over time, as you all know. We've been bringing you all along with news conferences throughout the past year. And we've had the vaccine now for just over a year. There were certainly some initial goalposts in terms of getting first and second doses in order to achieve a good level of individual and population immunity. But what we know is that we can't get rid of this virus. It is going to stay with us. There may not be such a thing as herd immunity. This is a term that I have not used for a very long time. But any vaccination level can help population levels of immunity. And we've just got a boost of that immunity as well from those who did get infected, at least against the Omicron virus. We don't know where the virus is going to evolve. That's the other thing that changes your vaccination goalposts as well. So we have to keep monitoring the evolution of the virus. Do we need to change the vaccine? What will we need to do in the fall? So these are all the different scientific questions and planning that we need to do moving forwards as we adapt to the longer term management of COVID-19.
Marika Walsh, Globe and Mail.
Good afternoon. I just wanted to clarify on the border. Just first of all, on the fact that we still have an international sweeping travel advisory in place, including for vaccinated travelers. One of the complaints that we've seen from protesters is that, we're sending hundreds of Olympians to the Olympics in China. Meantime, the message to the average citizen is that it's too dangerous to travel. Can you tell me if the travel advisory still makes sense and how you explain that disconnect to the average person watching your press conferences?
So should I start, Minister LeBlanc?
No, sure. Go ahead, Dr. Tam. Go ahead.
Yeah, so as with everything that's evolving, we are actively examining the advice for travelers. We've never stopped people from leaving Canada, but the current global travel advisory is avoid non-essential travel. It doesn't stop any individuals from doing so, but it is a really important message when Omicron has been surging and still continues to surge throughout the world. But we are actively examining that as we are doing for other public health measures.
Mr. LeBlanc, can you weigh in on that question, please, before I ask my follow-up?
Sure, Marika. I think my colleague Jean-Yves Duclos indicated at the beginning of his comments that we would have more to say, we hope, next week on the normal evolution of measures at our borders. Dr. Tam just, I think, repeated what we've been saying since the beginning of the pandemic, that we put in place the best measures possible based on the best medical and scientific advice we have. And they change as the circumstances or the virus changes. So I think we may have more to say next week based again on that advice and those discussions. I chair the Federal Cabinet COVID Committee. We're constantly discussing examples of border measures that are appropriate based on the context of the virus at this particular time. So I would think, Marika, you may have the chance to see us again next week with some precisions on our border postures.
Okay, thank you. And Minister LeBlanc, we're seeing a lot of sort of back and forth and finger pointing between Ontario and the federal government, with federal sources suggesting Ontario was a laggard in imposing these emergency measures. The Ontario government's pushing back on the record. Why does this finger pointing serve Ontarians who have voted for both your governments and who, both your governments are accountable to? And can you please set the record straight? Did Ontario refuse to act on the emergency measures earlier this week, and are they late in imposing them now?
So, Marika, thank you. As I said, I think some moments ago, we view very positively the measures that the Ford government announced earlier today. The Prime Minister has spoken with Premier Ford a number of times, as recently as a day and a half ago. Late last evening, I had a detailed conversation myself, again with Premier Ford, that was very constructive and collaborative. We and officials, senior officials from my department and the Public Safety Department, the RCMP Commissioner with the OPP Commissioner, the Deputy Minister of Transport, our Minister of Transport. Marika, these are ongoing, active, and very frequent exchanges as to what can we do collaboratively together to bring these illegal blockades and occupations to an end as quickly as possible. So the province properly has a number of jurisdictional tools that they can bring to bear on this illegal activity. The federal government has some law enforcement resources that we will obviously make available to any reasonable request from local or provincial law enforcement authorities. There are federal intelligence agencies collaborating with their provincial and local partners. So I have participated in numerous conversations many times a day, as have my cabinet colleagues and the Prime Minister himself, with our officials and with our counterparts in Ontario, particularly, but not exclusively in Ontario, with the governments in Alberta, for example, and other provinces who are understandably concerned about similar activities that are unacceptable. So we'll continue to do that work. And we view it, frankly, as essential that every jurisdiction bring to bear the maximum pressure they can to end these illegal blockades and occupations that are causing such understandable concern in communities across the country. We'll do everything we can. And today, the government of Ontario took what we think is a very, very important step that we hope will contribute to a rapid conclusion of the blockades at the borders and the unacceptable occupation of the streets of Ottawa.
Alors, c'est toutes nos questions pour aujourd'hui.
That's all for questions today.
I'd like to say thank you for going into overtime with us today. Unless you have a final comment, thank you. Merci, miigwech.